Good afternoon, folks. For today's discussion A, we are discussing how long-term COVID patients feel about services they've received and things. So we'll get into that for A today. Please join me for presentation A. Here we go. Long-term or long COVID patients often feel abandoned because clinical services, research funding, and public attention have not matched the scale of need. But there are concrete steps, legal protections, clinics, research trials, and support groups you can use now to get care, benefits, and community. If you live near Pennsylvania, start by documenting symptoms, asking your primary care clinician for a referral to a long COVID clinic or multidisciplinary service, and contacting federal disability give me 1 second, guys. Guidance, resources for help with benefits. What abandoned and forgotten means in practice. Many people report being dismissed, losing work, and facing social isolation after acute COVID, while symptoms persist for months or years. Patients' testimony and reporting show widespread frustration as emergency responses wind down. Care access is uneven. Some regions have multidisciplinary long COVID clinics, but many patients still struggle to find local specialists, timely referrals, or coordinated rehabilitation. Immediate practical steps. What to do this week. Document symptoms and limits. Keep a daily log of symptoms, activity tolerance, and how symptoms affect work, ADLs. This is essential for clinicians and disability claims. The United States Social Security Administration. Talk to your primary care clinician. Ask for evaluation referrals to cardiology, neurology, rehab as needed, and a written care plan. Mention long COVID explicitly and request multidisciplinary assessments. Find a clinician or specialist. Use national directories such as the Long COVID Alliance directory and recover clinics listings to locate the nearest specialized Center. If none are nearby, ask about telehealth options. LongCovidAlliance.org. RecoverLongCovid.com. Explore benefits and legal protections. Long COVID can qualify as a disability under ADA and federal guidelines. The SSA has a guide for medical evidence for disability claims. Start collecting medical records now. HHS.gov, the United States Social Security Administration. Research, funding, and hope for treatments. Research is advancing large initiatives, recover, and academic teams publish trial results and are testing candidate treatments. Federal grants have expanded clinic capacity and research infrastructure. These efforts aim to translate findings into therapies. Recover COVID Initiative, Nature COVIDhealth.com. Community advocacy and mental health. Join peer supports, national and UK charities, and moderated online groups offer peer support, practical tips, and advocacy networks. Long COVID SOS, Long COVID Alliance support pages, Benjamin Horn Center groups. Peer groups reduce isolation and can help navigate care. Advocate locally. Contact state health departments and your congressional office to request sustained funding for clinics and research, patient stories, and influence policy. Risks and limitations and what to expect. Okay, care variabilities. Not all clinicians are trained in long COVID. Expect some trial and error in symptom management. Benefit timelines. Disability claims can take months. Keep working with clinicians to build a clear medical record. Okay, key resources to use now. CDC public health guidance on long COVID surveillance, clinician resources. Okay, HHS DOJ guidance on long COVID as disability under ADA. SSA guide for medical evidence for disability claims. Long COVID clinics, directories, and support networks. Okay. Summarize eligibility for disability benefits, and draft a symptom log template and a short letter you can give your clinician. I'll include the exact clinic names, addresses, and contact details. Okay, guys, long COVID remains a widespread, often debilitating condition that many patients fear is being quietly disprioritized by policymakers and health systems. If you are in Pennsylvania, the most practical steps remain to document symptoms rigorously, work closely with your primary care clinician to access multidisciplinary care or referrals, and use CDC resources to support both clinical and decision making. Any benefits documentation. The deeper story behind the headline. The reporting you're referencing captures something bigger than a single article, a collective grief, a sense of error, unsure, and unsettling reality that a mass debilitating event is unfolding in slow motion. Patients describe losing years, sometimes entire futures, to an illness that still lacks clear treatments, predictable trajectories, or consistent public investment. What the journalism consistently reveals: a mass debilitating condition hiding in plain sight. Millions of people across the US and globally continue to experience long COVID, yet many feel they've skipped out of public consciousness, and political attention shifts elsewhere. Lives radically reshaped. Former nurses, teachers, caregivers, and patients describe going from active, engaged lives to struggling with basic tasks like showering, cooking, or walking across the room. A sense of abandonment. Patients often say the hardest part isn't just the symptoms, it's the feeling that society has moved on while they remain stuck in a body that no longer works the way it once did. A fragmented care landscape. Access to post COVID clinics is uneven, and many primary care clinicians are left to manage complex multi-system symptoms without robust training or reimbursement structures. What long COVID is and why it's so complex. Long COVID is defined as symptoms lasting at least 3 months after SARS-CoV-2 infection, and it can affect nearly every organ system. Common clusters include energy and autonomic dysfunction, crushing fatigue, post exertional malaise, dizziness, heart rate uh, instability, respiratory and cardiovascular symptoms, breathlessness, chest pain, palpitations, neurological and cognitive symptoms, brain fog, memory issues, sensory changes, pain syndromes, headaches, muscle pain, neuropathic pain. This variability is part of why patients often feel dismissed. There's no single test, no single biomarker, no single clinical pathway. These steps are especially practical for someone in Pennsylvania. Specialty access may be limited, and primary care often becomes the anchor. Document everything. This is your strongest tool for both clinical care and disability claims. Track daily symptoms and severity, triggers, especially exertion, functional limits. Can stand for 5 minutes, can walk a block. Work impact, dates of infections, tests, and medical visits. Guys, long COVID is a real reality. People are still suffering from it. So I thought I'd do a show on it today for y'all. A clear record helps clinicians see patterns and supports any benefit applications. Start with your primary care clinician. Use CDC long COVID clinical guidelines, which emphasize validating patient experience, symptom focused management, pricing, pacing, and energy conservation, targeted referrals based on organ symptoms involved. You have to make sure that everything is documented, folks. So that is your A for this afternoon. I will be back on for B after lunch. And we'll see everybody later for B. For now, Gator Wellness, take care, folks.